My name is Desmonaiti. I'm 21 years of age and I want to be a livestock farmer and also specialize within the field of pig or pork farmer.
My name is Gilbert Awito and I am 29 years old now. In the future, I want to become a website developer.
Hi, I'm Edwin. I'm 13 years of age and I want to become a prominent lawyer.
My name is Johnson Adoboy. I'm 21 years and I want to be a writer and a human resource manager.
Hi, I'm Seth. I'm 15 years and my dream is to become a medical doctor and add music to it.
We all have dreams, but these individuals who live with hemophilia have life-limiting challenges to getting a chance to even start pursuing their dreams.
Hemophilia is a bleeding disorder that is inherited. Individuals who have hemophilia do not have the necessary protein that is required for blood to clot. This means that such individuals can bleed even without a trigger, or they bleed with minor surgery or minor trauma. The mode of inheritance for hemophilia is X-linked. X is a sex chromosome. So from this, it means that most of the patients we have are males. These male patients can bleed at birth. The very first presentation they can come with is that after delivery, when the cord is cut, they start bleeding from the cord. Some of them too, after circumcision, they bleed for prolonged hours, and this can lead to death. Some children, when they start crawling or moving around, you notice that their joints, usually their knee, tends to swell up. Their elbows can also swell up. They can bleed under their skin, so it leaves dark patches under their skin. Some of them can also bleed when they have loose tooth. Some of them can come with really life-threatening bleed. Some of them can bleed into their abdomen. Some of them can bleed into their chest. And the most serious ones that usually kills them is when they bleed in their head, what we call intracranial bleeds.
Hemophilia presents in many people in different ways, and with limited exposure and understanding can be misinterpreted by family members and caregivers, leading to serious mobility and possibly life-threatening outcomes.
I have 3 sons. They were all hemophilia children. And during circumcision, he was bleeding. So instead of probably allowing him to go or discharge, he were kept for almost 2 weeks. And through that, we got to know he had a hemophilia. In fact, after he had got 4 years, he died when he was bleeding from the tank. Doctors decided to stitch it, and the blood was oozing, and through that he died.
For these young people, life is a daily struggle since their diagnosis, a challenge that affects not only them, but their families too.
It's been quite challenging, especially with his education, because there are times that for a whole term he cannot go to school because anything at all, any movement at all will result in him bleeding into the joints. And the pain is unbearable sometimes. It's been quite difficult, especially seeing him in pain. And even for me, sometimes going to work becomes a problem because I can't see him in pain and then I leave him for work.
There are certain activities I'm supposed to do and not to do, like engaging myself in harsh activities like football games or any activities that will harm me. So it's quite difficult living with it at school because watching my peers have normal lives, they play around, and I don't have the opportunity to mingle with them because of my situation.
But being a hemophilia, like sometimes mingles with how I want to be because people will say, like we can't include you in things because you are a hemophilia patient, you are sick and all those things, like you are weak.
Hemophilia, yes, is a rare condition, relatively rare, with requiring complex diagnosis and management. The management of hemophilia requires a comprehensive care plan, and the comprehensive care plan is should ideally be given by a multifunctionally comprehensive care team. So the care team of people who would be giving care, adequate, appropriate care for hemophilia patients would involve a hematologist, would involve a pediatrician, an internist, specialists in orthopedics and trauma, dentists, would involve physiotherapists. Most importantly, would involve very caring nursing staff who would bend over backwards to nurse patients who came in with acute conditions.
I come into contact with hemophilia patients on a daily basis, where I give them treatment on demand, prophylaxis, which is treatment given to patients to prepare them for future bleeds. Then I counsel and educate patients as well. After diagnosis, most patients feel they wouldn't be able to fit into the society or live a normal life. So they are taken through counseling and education just to prepare them to live a normal life in the community.
The treatment, although available, is often beyond the reach of the families due to the cost involved.
Getting the factors always available is one of the things that we always pray for. There are times that you go to the hospital and then the factors are not there, or the ones that are there are not even enough, and they can't give all to you, so they just give you some, which is woefully inadequate for you, but you just have to take it and live with it.
Statistically, 1 in every 10,000 children born will have hemophilia. But with little information about the condition and the lack of a database tracking hemophilia cases in Ghana, many children suffer in silence and die without a chance to live their full potential.
Although we get the factor for free, the needles, the cannula, the cotton and the gauze that you need to infuse this factor into these patients are not for free.
Hemophilia is one of the conditions that is covered under the National Health Insurance Scheme. Unfortunately, the medications that are needed to treat people who have hemophilia are not available, and so parents and families have to pay out of pocket for these medications. So in practice, there really is no cover because they have to pay for the medications that they need for life-saving treatment.
The work of the Ghana Hemophilia Society, though a noble one, is fraught with a number of challenges. Largely, funding to map the cases across the country and support from the State Health Agency and the National Health Insurance Authority to make treatment accessible to patients under the National Health Insurance Scheme.
Under the hemophilia care. So we went around all the regional hospitals, created teams, and through workshops tell them what hemophilia is and how to educate them. Now, apart from the medical people we created in all the regional hospitals, the team went on radio and TV and talk about hemophilia, the occurrence, its treatment, and how patients and parents must handle themselves when the hemophilia issues cropped up. The structure is there, where the doctors and nurses will take the names and the parents and the numbers and their diagnosis and their treatment. So that structure has been created by the support of WFH, and then by and by we get these patients on a database. Over the years, the society has benefited from WFH in terms of the drugs that hemophilia patients in Ghana use for treatment. And I must mention that as we speak, the society has on the database around 400 patients of hemophilia. And we secure these factors through donations from WFH to help them in treatment. If hemophilia should be covered, it must be covered comprehensively. For instance, we need to identify the patients, then we need to diagnose them with lab, and we need logistics for the diagnosis, and then we need treatment. I'm talking about the factor concentrates that we need to treat them. Now, all this chain that I mentioned are not covered by a National Health Insurance scheme. So the society makes efforts to help patients in treatment. Number one, on our outreach programs, we identify the patients, and then we have a system at the laboratories in Kumasi and Accra where the patients go and get diagnosed. But it's a challenge there because when they don't have the money, they are not diagnosed. The labs lack logistics to diagnose their disease and therefore classify them as whether they are A or B or whatever.
Whilst there's no known cure for hemophilia, there's hope that a person living with hemophilia will have a chance at life through its management.
Hemlibra, or emicizumab, is a man-made antibody that mimics factor VIII in the clotting cascade and allows for people who lack factor VIII, who are otherwise called hemophilics with hemophilia A, able to stop bleeding when they have an injury. I am unable now, before approval, to tell you exactly how much the product will sell for because we don't even have approval yet. But what I can tell you for a fact is that when Hemlibra is available in Ghana, we will, by similar means, ensure that the patients who would need them will have access to them.
WFH is bringing these drugs to us, and then we are administering them on our patients, and the result is good. What is important is that the Ghana government must make steps and arrange to be able to secure or purchase these drugs for hemophilia patients in Ghana. There are a few challenges the society faces over the years, and we are still managing. Number one, we wish we could have sufficient funds, that means government, to bring in the factor concentrated drugs for our numerous patients. And that hasn't happened yet. That's our major challenge. Number two, diagnosis for our patients that we bring on board have challenges being diagnosed. Sometimes they go to the hospitals and they will tell them that go and come in 2 months time when we hope we can have reagents to test you. So many patients have reported, potential ones, and gone without being diagnosed and therefore being treated. So we need the government to help us getting reagents and other logistics that will help treat the patients and diagnose the patients, eventually be able to treat them. Then again, society itself for over a decade now has been self-supporting because our several attempts at fundraising have not yielded any fruits because anytime we approach companies and individuals, they don't appreciate hemophilia. They have no idea what hemophilia is, and therefore they think it's just a scam or they don't get it. So we haven't had the benefit of fundraising where people come in and help. So if the government comes in to help with reagents and the like, maybe it will in a way help the society also be able to a little bit of funding support. And we need the government to help us because the staff we work with are on voluntary basis. You know, the remuneration is not like top level where they will be very happy because they are voluntary work for the society. And then when we go on outreach, we have to self-finance outreaches, cost a lot of money to do outreaches. So these are about the few of the challenges that we have. Therefore, we need government support.
Imagine being a mother and having 5 sons, all who have hemophilia. Imagine traveling afar to come for factor infusion every week and having to pay for each one of them. It's not an easy task. So we are appealing to the government of Ghana to come to their aid and help put hemophilia under the National Health Insurance Scheme, so together we can lighten their burden and help them live a quality life.
Every dark cloud has a silver lining, and the hopes of these and many other individuals living with hemophilia will be hinged on accessibility and the focus given to their peculiar condition.